Let's start our lecture by talking about the hip bone. Some anatomists do not consider it to be a part of the lower limb, as the term limb applies to appendages. But just like how the upper limb is connected to the axial skeleton through the scapula and clavicle bones, the lower limb is connected to the axial skeleton through a hip bone. Hip bone is also known as coxal bone or innominate bone. It is a large irregular bone which is composed of three bones: ilium, ischium, and pubis. As you can see, they are of different colours. We have done it so for your ease. There are two hip bones present at each side of the bony structure known as the sacrum. These two hip bones and sacrum form the pelvis, or more accurately called the pelvic girdle. The hip bone is a connection between the axial skeleton, which is the main trunk of our body, to our lower limbs. This happens with the help of three joints. The sacroiliac joint, which is the articulation of hip bones with the sacrum. Pubic symphysis is the articulation between the left and right hip bones. The hip joint, which is the articulation between the acetabulum and the head of the femur. The acetabulum is a cup-shaped socket formed by the union of ilium, pubis, and ischium. The head of the femur articulates with the acetabulum to form the hip joint, thus connecting the lower limb with the hip bone. We shall now look at the individual parts of the hip bone and their respective bony landmarks. The hip bone is comprised of three parts: the ilium, pubis, and ischium. Here you can see the hip bone from three different views. The parts are highlighted in red, yellow, and green. Let's talk about ilium first. The ilium is the widest and largest of the three parts of the hip bone and is located superiorly. The body of the ilium forms the superior part of the acetabulum, that is the acetabular roof. It has the following parts: two ends, upper and lower end, three borders, anterior, posterior, and medial border, three surfaces, gluteal, iliac fossa, and sacropelvic surface. Let's look at them one by one, starting with the upper end. The upper end of ilium is also known as the iliac crest. It is elongated and expanded and makes up the upper border of the ilium. Here, two other structures are present that you must know about. One is the anterior superior iliac spine, ASIS. It is a projection situated at the anterior end of the iliac crest, as highlighted here. Second is the posterior superior iliac spine, PSIS. It is a projection situated at the posterior end of the iliac crest, as highlighted here. The crest is divided into ventral 2/3 and dorsal 1/3 segments. If we look at the ventral segment closely, it has a outer lip, inner lip, and an intermediate segment. The outer lip has a tubercle precet at 4 to 5 centimeters behind the anterior superior iliac spine. It is known as the tubercle of the iliac crest. As for the dorsal segment, it extends from its junction with the ventral 2/3 to the posterior superior iliac spine. It presents an inner and outer surface separated by a ridge. Moving on to the lower end of the ilium, it is smaller and forms about 2/5 of the articular surface of the acetabulum. Now let's talk about the borders of the hip bone. First we have the anterior border. Anterior border, it extends from the anterior superior iliac spine till the acetabulum. You can also identify the anterior border by a small notch, present just below the spine for the lateral cutaneous nerve of the thigh. Anterior inferior spine is a projection in the lower part. As for the posterior border, it extends from the posterior superior iliac spine to become continuous with the posterior border of the ischium, as shown here. From above downwards it presents posterior inferior spine, greater sciatic notch, ischial spine, and lesser sciatic notch. Medial border. It extends downwards from the iliac crest till the iliopubic eminence. It separates the iliac fossa from the sacropelvic surface, and its lower part is smooth round and is called the arcuate line. If we look at the surfaces now, first, we have the gluteal surface. Gluteal surface is the outer surface of the hip bone, named so because of the gluteus muscles in the region. It is convex anteriorly and concave posteriorly. This surface is bounded above by the iliac crest, below by the upper border of acetabulum, in front by the anterior border, and behind by the posterior border. It becomes continuous with the posterior surface of the ischium behind the acetabulum. The gluteal surface is split into 4 spaces by 3 lines. Posterior gluteal line. It is the shortest line which extends from the outer lip of the iliac crest, 5 centimeters anterior to the posterior superior iliac spine, till a point right in front of the posterior inferior iliac spine. Anterior gluteal line. It is the longest line which extends from the middle of the upper border of the greater sciatic notch to become continuous with the outer lip of the iliac crest. Inferior gluteal line. It extends from above and behind the anterior inferior iliac spine and runs down and back till the upper part of the greater sciatic notch. The next surface is the iliac fossa. Iliac fossa is the large concave area on the inner surface of the ilium. It is an area which lies between the anterior border and the medial border. Above we see the iliac crest. It is smooth and concave. It presents for the nutrient foramen in its posterior inferior part, which transmits the nutrient artery. A groove is present between the anterior inferior iliac spine and iliopubic eminence, which lodges the iliopsoas tendon. Lastly, we have the sacropelvic surface. It is situated behind the medial border and is divided into 2 parts, sacral part and the pelvic part. Sacral part presents with an auricular surface anteriorly and the iliac tuberosity posteriorly. Auricular surface. It lies below and anterior to the iliac tuberosity. It resembles the shape of a pinna of the ear, hence the name. It articulates with the auricular surface of the sacrum. Iliac tuberosity is a rough area below the iliac crest, as shown here. Pelvic part lies below and anterior to the auricular surface. It is smooth and is continuous with the pelvic surface of the ischium. Preauricular sulcus is a groove which is situated in front of the auricular surface and along the lateral margin of the greater sciatic notch. That is all about the ilium. Now let's jump into the details of the pubis. The pubis is the most anterior portion of the hip bone. It articulates with the opposite bone forming the pubic symphysis. It also forms an anterior 1/5 of the acetabulum. It consists of a body, superior ramus, and inferior ramus. Together, the superior and inferior rami enclose part of the obturator foramen, through which the obturator nerve, artery, and vein pass through to reach the lower limb. Pubic body, located medially, it articulates with the opposite pubic body at the pubic symphysis. The body of the pubis is flattened, and it has a superior border called the pubic crest. Then laterally, it has this distinct pubic tubercle, which is an important landmark. It has three surfaces: anterior, posterior, and medial. Anterior surface, which is rough superiorly, and elsewhere it's smooth. Posterior surface. This surface is also known as the pelvic surface. It is basically forming the anterior wall of the true pelvis. And medial surface is also known as the symphysial surface because it articulates with the opposite pubic bone to form the pubic symphysis. That is all about the pubic body. Now let's talk about the superior pubic ramus. It has three borders and three surfaces. The superior border, also known as the pectineal line, is shown here. It forms the pubic part of the arcuate line. The inferior border is quite sharp and forms the upper margin of the obturator foramen. The third border of the superior ramus is the anterior border. The anterior border is called the obturator crest, as shown here. The three surfaces of the superior ramus are the pectineal surface, which is triangular and lies between the anterior and superior borders, from the pubic tubercle to iliopubic eminence. The pelvic surface is present between the superior and inferior borders. It is mostly smooth and is continuous with the pelvic surface of the body of the pubis. Lastly, the obturator surface is lying between the anterior and inferior borders. It presents the obturator groove. Inferior pubic ramus projects towards the ischium. It extends from the body of the pubis to the ramus of the ischium. It unites with the ramus of the ischium to form the ischiopubic rami. This ischiopubic ramus formation is clinically very important. We will now talk about the third part of the hip bones called the ischium. The ischium forms the postero-inferior part of the hip bone. It makes up about posterior 2/5 of the acetabulum. Much like the pubis, it is composed of a body, an inferior ramus, and a superior ramus. The ischial body is the thick and most massive portion of the ischium. It has two ends, three borders, and three surfaces too. So, let's discuss them one by one. The upper end is forming postero-inferior 2/5 of the acetabulum, as you can see here. As we already know that ilium, ischium, and pubis all contribute to the formation of this shallow depression. The lower end forms the ischial tuberosity and forms a certain angle with the body of the ischium. The ischial body has this projection known as ischial spine, which also makes a sciatic notch below. The handle-like portion highlighted here is known as the ramus. Now coming to the borders. The anterior border forms the posterior margin of the obturator foramen. The lateral border separates the femoral surface from the ischial tuberosity. It lodges the obturator externus tendon in the upper part. The posterior border is continuous above the posterior border of the ilium and helps to form the greater sciatic notch. A projection called the ischial spine can be seen at the end of this border. As for the three surfaces, the femoral surface faces downwards, forwards, and laterally. It lies between the lateral and anterior borders. The dorsal surface faces upwards, backward, and laterally. It lies between the lateral and posterior borders, and it is continuous with the gluteal surface of the ilium. Pelvic surface. It is smooth and lies between the anterior and posterior borders. Determination of the side of the hip bone. The ilium is expanded and projects up, while the pubis faces forwards and medially above the obturator foramen. And acetabular cavity faces forwards, downwards, and laterally. That is all about the hip bone. We will talk about the muscular attachments at the hip bones in an upcoming video.
Have you ever heard of video books? sqadia.com is delighted to present video books, medical books that have been tailored into a series of videos. sqadia.com videos are presented in the same order as the book's chapters. Explore now and make your learning easy.